All right, we are live now on Facebook. So welcome everyone to our Hale Hawaii / High COVID community town hall meeting. We are answering the question, how is it going at schools today? That's what we're working on. And we have a panel of experts here who are going to help us give feedback on how it's going and answer any questions people might have about it. So we really appreciate you guys being here today. And first off, we are going to actually start off with a short pule from Kumu Leilani to open us up. So I'm going to go ahead and stop sharing screen and we will all pay attention to that first.
Mahalo, Kara, and to all your team there. And especially this week with all the Keiki and Kamali'i returning to school, so the administrators, educators, parents in our community, thank you for continuing to keep our children safe. And as we continue to walk forward, especially with the unknowns. And I bring this oli in, that'll be our pule, that was handed down to us. And it's an oli, a chant of protection. Mahalo again. This has been a privilege to be part of COVID since we began last year. No, wana keo kuikana hele hele yala e ke kio hoek wako. E na kino malui kalani malue ho. E ho lumaya na ikona kako. Makono, makono. Makono.
Thank you. That was beautiful.
Dana, you're on mute.
There we go. Thank you so much, Leilani. That was beautiful. And we are going to start our main part of the meeting now, which I would like to introduce Murray Ellsworth. She is going to be bringing up our Padlet, which we will be sharing with everyone. And you will be able to answer these questions anonymously by going to the Padlet links. So we are going to post the links one at a time in the chat here. We are also posting them on our Hale Hawaii Facebook page. So you can go ahead and go to the Hale Hawaii Facebook page if you are watching on Facebook, and we will slowly post the links as the Padlets come up. Otherwise, yes,
are we going to introduce our speakers?
Oh, yes. Sorry about that. Thank you, Murray. So first, I'll bring up our panelists, a short introduction. Let's see here. There we go. Our panelists today are going to be Professor and Dr. Lee Altenberg, Chad Meyer, Lauren Pang. We also have Denise Cohen, who has helped a lot with the University of Hawaii. We have case investigators and contact tracers. So if I could have each of you introduce yourself and kind of tell us a little bit about your expertise, we would appreciate that. I'll start with Dr. Pang.
Okay, thank you. My expertise, I'm a physician. I'm boarded in preventive medicine. Most of my publications were in infectious disease, HIV, rabies, malaria, dengue. And now we just take on this coronavirus. I have consulted for the last 10 years to the US Congress. I consult for them, their medical research program looking at emerging diseases. I've taught for the World Health Organization for 20 years, retired now. And I used to be with the Walter Reed Army Institute of Research, testing drugs, vaccines, diagnostics for about 24 years. Retired, came to Maui. I'm your district health officer for the last 20 years. And today I speak as a private citizen. It's not that I disagree with the Department of Health. They sometimes can't figure out quite yet what their opinion is.
Thank you very much.
Thank you.
Next, Dr. Chad Meyer, would you like to introduce yourself?
My name is Chad Meyer, full name Bernard Meyer. Sometimes it comes up Bernard on the icons. I first practiced for 20 years in the Foreign Service, overseas, multiple assignments to Asia and Africa. And in that capacity, I was responsible for public health of Americans overseas in the embassy at large communities, and also clinical practice. And I oversaw medevac facilities for the embassy services in Bangkok and Singapore. I retired in 1998, and I worked for 4 years as a high school and middle school instructor at Hana School after getting a baccalaureate degree from UH in teaching. I have a master's in clinical tropical medicine from the London School of Tropical Medicine. I was a participant in designing and printing up the guidelines for rat lungworm in Hawaii. And I've written and co-authored papers on rat lungworm in the past year. I'm retired from clinical practice. I consider myself a community consultant and predominantly on public health matters. I've worked with Dr. Pang on the dengue outbreak we had back in 2000, 2001. And I know him from long ago in Bangkok days, and I'm not going to say what years those were, just for his purpose. That's my resume.
Awesome. Thank you so much. And then Dr. Lee Altenberg, if you would like to introduce yourself.
Hi, yes, my expertise is in population modeling, in the mathematics of complex population processes, which pandemics are an example of. And I got my undergraduate degree in genetics at UC Berkeley and my graduate degree in theoretical population genetics at Stanford. And I moved to Hawaii back in 1994. When I was on Maui for 19 years, I got involved with conservation and helped to set aside from golf course development a patch of Willy Willy forest in Kihei in Wailea 670, and helped with get the light pollution ordinance for Maui passed. And so I'm one of 2 theoretical population geneticists in the state of Hawaii, and I'm faculty in the departments of mathematics and information and computer sciences at University of Hawaii at Manoa.
Awesome. Thank you so much. And then Denise Cohen, I know you're a last minute panelist, but would you mind giving us a quick synopsis of what you've been working on during COVID and a little bit of your expertise?
Hi, my name is Denise Cohen. I just retired as a professor of nursing. I have a PhD primarily in vaccine acceptance, but I also did some research in best practices in pandemic response. I've also worked with Dr. Pang for the last 20 years on several committees. I wrote the pandemic response for the college, so I helped the college design from January of 2020 until I retired in December of 2020. The response, I've stayed on the COVID task force with the college, and I actually talked to them about continuing and looking at the Delta variant and how much damage it's doing. So that's my expertise, is helping actual institutions set up plans and implement them.
Thank you so much. Sorry, I meant to call you Dr. Denise Cohen. So we really appreciate you jumping on our call and volunteering to be part of the panelists to answer some of these concerns that teachers and parents might have today. So now I will move on to Murray Ellsworth. If you want to introduce yourself, and then you can share with us the Padlets. We'll start sharing out those links for people to participate.
Sure. My name is Murray Ellsworth. I'm a teacher in Hilo, Waikea High School. I'm currently on leave under ADA accommodations because I have health conditions. And I am just an activist trying to help save lives if possible. I'm just going to be using this Padlet for the first time. So I really hope that it works out. what I love about the Padlet is it's very anonymous. So even those of you who are watching on Facebook, we're going to have people putting the links to the Padlets, each one at a time. And what we're going to do is give you an opportunity to put a sort of Post-it note on a virtual wall to give us information anonymously about what's going on in the schools. So we're going to start out with our first one. We hope this works out. And please just follow along, participate, and just be as honest as you can. We have a few rules. They will be posted on each wall. Just no opinions, please. Just report what is happening to the best of your knowledge. And please don't put any names of people in the posts. We do have a zero tolerance for misinformation, and we have the experts to tell us that it's misinformation. They'll be pointing it out, and we just want to respect one another. So here we go. Let's try it. So if you're not clear what we're doing, just put that HTTPS tiny URL into your browser. It should bring you to a Padlet, and on the bottom right-hand corner, there's a plus sign, and it will give you a little box to write in. And then when you click outside of the box, it should post it on the wall, and we'll be showing the wall very soon.
Yeah, the Padlet links will also be posted on the Hale Hawaii page. So if you are on Facebook, you can go to the Hale Hawaii page, and there will be a post with each Padlet link as they come up. Right now, we're just waiting for people to put answers, and we're going to show you the wall of the Padlet. So that's what we're working on.
Thank you for all of you participating. Appreciate you chiming in and telling us what's happening. What kind of COVID-19 testing have you seen or heard of among school students? So we're seeing a lot of none, and we're seeing a long one here about how can the DOE and DOH get better at contact tracing. My principal sends out notification to staff that there was a positive COVID case, and lets DOH, oops, things are moving around. That just shifted around. Let's see. One teacher I know wasn't notified until 5 days later after being exposed to someone who was COVID positive. And how can we advocate for the same kinds of mitigation procedures as the Maui film industry? Okay, so that was this longish one. Do we need any scrolling for the experts to see what's going on? Any requests for scrolling up or down?
This is Lauren. I'm okay.
I would like you to scroll up a little bit.
Oh, that's a good picture there. If you could scroll through that slowly.
So we see a lot of no, none. I see one temperature check. That I've not heard of very recently, so that's interesting. We do have at least one school that's doing that. So I'm going to scroll up just one more time in case new things came in. So I'll turn it over to Kara to facilitate some possible responses.
All right, so we'll go ahead and stop sharing the video. I think we have a pretty good idea what the responses are. Do you want to scroll down one more time before you stop sharing, just in case
Sure.
someone's added?
Does anyone, or do we want to leave it up so people, so they can refer to specific comments? Do we have anything else to share on the screen right now?
No, but we will not be able to see our panelists other than one at a time, which is fine as they unmute. If we want to see all of our panelists, we would need to stop sharing.
Okay, so I guess I will stop sharing unless anyone wants one more glance. Last call. Stop sharing then.
All right. So those were our responses. We'd like to get your feedback on what you think about that and what would be the best case scenario sort of situation. So if any of our panelists want to raise their hand, we can call on you to address. It looked like mostly no testing happening at schools, and give us feedback on if you think it's necessary or productive to do that. Okay, Dr. Pang would like to answer. So if you could unmute Dr. Pang, we will spotlight you.
Okay, so I'm trying to watch the system being put in for the testing of schools, not just on Maui, but Hawaii-wide. First of all, they addressed the public schools, and I've asked, what about the private schools? And they said, well, they hope they can follow along. But, you know, it's always going to be 10% of the people cause 90% of the problem, or 90% of the source of the outbreaks. But let's just set that aside right now. So lately, we have been reviewing bids for testing at the schools. There's these companies stepping forward to say they'll do the testing at the school. There's some technical stuff, how often you're going to do it, what's the test you're going to use, are you going to pool the samples, et cetera, et cetera. But I'm not sure when the bid processing ends and when we bring them on. So there might be a kind of an interim gap. So the day after these, I sat on some of the bid proposals. The day after that, there was a call up for my nurses and the National Guard to just start testing. I don't know if that's permanent, if that's interim. Anyway, it's a little bit discoordinated, okay? But let me just take a step back here. Testing is important. Yeah, we got to try to figure out technically which is the best, cheapest, most efficient way. Yeah. And then what do you do with the test, the contact tracing? So there was a question on that. We'll address it later. But then there's that question, good, you did the testing. For everybody in the school system, including their families that they come from, including the workers, how many did you miss? So is it mandatory or voluntary? Because classically, when you start looking at COVID, you know, that system, boxing in COVID, test widely, contact trace completely, isolate and quarantine. When LA saw it, not Delta, for everyone they knew about, there were dozens that were outside the system. So is it like diminishing returns here? Are you spinning your wheels? And finally, I'll leave this thought with you. No matter what we did before, how well or how poorly we did the schools before, that was normal COVID. Normal COVID. This is Delta. And it's so much that in my office, I call it Dovid, D for Delta. My wife says, don't do that. Because when Lambda comes, you're going to call it Lovid. whatever. I really do want to stress Delta is a lot more transmissible. It's probably faster and more. It is, if you get it, causing more severe illness, maybe even in kids now. And then the ability to dodge the immunity, either from a prior infection or from the vaccines. So now you have a very, very dangerous variant. You think we could handle it? Well, we handled the UK. We handled the Brazilian, okay. We handled the California. But almost by default, we're stuck with this one because you can't handle it. If we could handle it, we wouldn't be talking about Delta. So we'll leave it at that. Let other people talk, and we answer some of the questions about contact tracing later. Thank you.
Awesome. Thank you. And I saw Dr. Meyer, you had your hand up. Did you want to say something on this?
I think testing falls under, my first issue is who's in charge in the school? And what I'm hearing is Department of Health is no longer responsible for contact tracing of an infected case or a potential case. And if you don't have a captain, who's going to run the program? I think it's unrealistic to say the principal of the school is in charge. They have no formal training in this. They don't understand contact tracing. They're overwhelmed already with the responsibilities of managing this case. And I'm frustrated that it's there's no guideline and it's a free for all. No one is stepping up to the plate. It would be nice if we could have our Medical Reserve Corps on Maui be ready responses for individual school campuses and put something in place. What are you going to do with someone designated as a contact case by a rapid test? You got another couple of days to have a PCR confirmation. We got to remember this is still a low risk population in terms of the numbers, so that's going to modify the meaning of a positive test. We need confirmations. It's going to be 2 or 3 days. If you get a positive test, what does that mean for contacts and their contacts? I can see entire classrooms being put into quarantine for 10 days. And then what happens to education then? Is there a backup plan for remote learning if somebody is in a situation of isolation or quarantine? None of these issues are being addressed. It's just, let's go back to school and see what happens. It's going to be piecemeal. Every school community is going to be responsible with their own task. I'll end and for response from others. Thank you.
Thank you very much for your thoughtful response. I saw Dr. Cohen, you had a comment.
Yes, this is a comment, and I guess I just want to talk about what UH is doing. We have an application that will be going system-wide to all 10 campuses called Luminance, which will do the screening or have the screening before you can come on campus. Plus, if you're vaccinated, upload your vaccine card. Some of the issues, and they're just rolling this out, but when I've been looking at our plan, they're also planning that if you don't have the vaccine, you have to be tested weekly or every 3 days. And certainly for our students who are healthcare workers, they have to either have the vaccine or be tested routinely. My question is what kind of testing we're going to do? Dr. Pang kind of alluded this. Are we going to be doing PCR? Are we going to be partnering with clinical labs? Are we going to be doing our own? We have molecular assays at the college for those that have campus health centers, or are we going to do the antigen testing? And I'm thinking, and Dr. Pang might be able to answer this better, what is wrong with doing antigen testing? If it's positive, we're still going to have to deal with that as a positive, rather, even if we do a confirmatory. So that's just some of the things that we're working on at UH right now.
Yeah. Dr. Pang, did you want to respond to that or?
Oh, yeah, I can.
Okay.
Sorry, I
And could
couldn't
you
raise my hand.
explain, can you also explain for the viewers who might not know, what's the difference between when we're talking antigen, PCR, confirmation? People might not know these three things.
Okay, antigen, it's not that sensitive That means a lot of people could be positive, but you missed it. But it does cover a wide variety of COVIDs. Yeah. The PCR is very sensitive. It will amplify and amplify until it blows up one copy into enough to detect. But it takes time and it's expensive. But the antigens are quite good. In general, when you do sequential testing, like if you went to the prison and tested twice a week, antigens testing are pretty good. Even though they're not sensitive, you're picking off the whole course of illness. So if somebody has a course of illness of COVID, say a week, the first 2 days it's too low to detect. Then you can detect it. Then it kind of drops off. If you cover it with frequent testing, that's better than just one sensitive blast when the guy is not shedding all that much. So it can be used sequentially versus a single shot. Sequentially, I like it twice a week. Some guys say 3 times a week. When we were testing here on Maui, the construction workers, every 4 days was good. But how often is the school going to test? Well, if they test antigen, it'd be nice twice a week. If they're not going to test antigen PCR, well, I guess once a week then. Anyway, this is kind of in a flux. And like, why are we doing the public schools, and the public schools just kind of tag along? I want to address what Chad brought up. So what? We get the positive tests. Who's going to do the contact tracing? Well, this is COVID. This is Delta. It's more people have been exposed faster and probably a little bit independent of who got vaccinated or not, because it's seeping through, eroding the protection of the vaccine. So let's go contact trace. When? 2 days. You got to do 9. Okay. So the case number is rising. There's simply not enough people to do it. The end. Too much contact tracing. Yep. So we tried to hire more and then even more, but the new people, the Medical Reserve Corps, they used to come on, they used to be paid, they got burned out. 45% of the people you call back, they just don't answer. When you call, reach them, 12%, they don't want to talk to you. They hate you. Fine. We're obliged to contact trace. That burns out a contact tracer. It does. So the new ones we hired, I think 3 of them quit after the first 10 days. They said, wait a minute, I wasn't cut out to do this. Not at the pay you gave me, and not at any amount of pay. It's too insulting. It's like barging into people's homes when you haven't been invited. Okay. So I get it. But it's just a matter of fact. When you got so many, you need to do so quick, and they're already upset about what you're going to tell them. Quarantine and isolate, and you don't have a place for me to quarantine, do you? We do not have enough contact tracers. Furthermore, that was a luxury. When the case number rises, like it did before, boxing in COVID, all that testing, contact tracing, and isolation, quarantine, they said, forget that. Just go with mass education for mitigation, distancing, masking, no crowds, et cetera, et cetera. So everyone stared at Hawaii and said, wow, you guys really work hard, contact tracing. Maybe that's what controlled it, because you nipped it in the bud. You boxed in COVID when it was small. Now it's out of control because it's COVID. And I think, truthfully, you're spinning your wheels if you think you're going to do the contact tracing that we used to do. So we're going to have to prioritize. Who gets the priority? What do you think? Schools? If the cat's out of the bag and the school is going to pick up 10 cases and you're going to quarantine away 8 for each case, you might as well shut the school down. And that's what we will watch. Yeah? Too much outbreaks at one school shuts the school down. Is it school by school? I guess so. Unless you're willing to shut down all the schools because a couple of schools were pretty hyperactive. So anyway, all I can do is kind of watch, test. You must test. We'll talk about that later. I haven't given up yet. I'm just talking about addressing the questions. Over.
Is the DOH still using the same guidelines for contact tracing, 15 minutes within, is it 3 feet now? Or are the contact tracing guidelines updated for COVID? I guess is the only question.
Yes.
Not
And
on Oahu.
well, it's kind of like the same thing, but it breaks through on the previous vaccination. If the guy said, "Oh, I was previous vaccinated," well, let's continue because there's seepage and erosion of the vaccine to protect you. Okay.
Okay. And then Dr. Meyer, I see your hand up again. Do you want to comment? Oh, you're muted. Sorry. Oh,
Okay.
there you go. Oh. Hold on, you're still muted. I think nobody push. There you go. Thank you.
Okay, I'm showing unmute now. Sorry.
Yes.
I would like to see individual schools have an MRC group to manage their outbreaks. I think that we have a chance when we got a controlled population to do much better than when we had at-large population of contact tracers from Oahu calling up families in Maui, trying to list their contacts and advise them. If we have MRC people located in our communities, or at least concerned individuals with some background who want to be participants for the school community, we've got a chance to contain this. Otherwise, we're going to be shutting down classrooms one after another.
And just to clarify for people who may not know, MRC is the Medical Reserve group that we have here on Maui, a group of volunteers who have a medical background. All right, so I think that's it for this question. We do have a lot of questions coming in on Facebook, such as what happened with all the rapid antigen test DOH and Hawai'i had in storage last year for schools. I don't know if anybody knows the answer to that or wants to address that. And then also long COVID in children, if we're seeing it. I don't know if anybody knows the answer to that, but those are some of the comments we had. One other comment is teachers are not wearing masks or taking them off and allowing other kids to take masks off indoors. Where can parents report these kind of things? I don't know if anyone wants to address any of those questions or knows the answer, but those are some of the things we're seeing on our Facebook and chat right now. All right, and if not, we can get into them later. Oh, Dr. Peng, I see you unmuted.
We do have a lot of antigen tests and newer ones and better ones, actually. The kids can just apply it themselves to the outside of their nose, but you do have to observe it so it's not fraud. And then it should be sent off. And then there's some that we apply to their nose and we can read it right there. So we do have a lot of new ones, okay? Sorry, take one more of your questions. What was one of your questions?
Where can parents report if their teachers are taking off masks or allowing all the kids to take off masks, basically if they're not following the good guidance that was put out for schools? And I don't know if you guys know the answer to that.
I don't know the enforcement. I don't know the enforcement. We can barely figure out the recommendations. Okay.
Okay.
So I don't know the enforcement part. Over.
Thank you. All right, so now we'll move on. We can talk about if anybody wants to think about or knows about long COVID in kids, that might come up again. But Maria, I'm going to turn it over to you and we'll start our second Padlet.
All right, thank you for everyone who participated in the last one. Now I'm going to share my screen once again.
All right, and we also are posting the Padlet links in the chat and also on Facebook. So if you want to answer these questions as a parent or teacher, you can go on to Facebook, Hale Hawaii page, or you can answer, click it in the chat.
All right, question number 2 is how will your school provide notification of a positive case? What is it that is your understanding of the notification process at your school? So the Padlet link is here. It's going to be posted in the chat in Zoom and in Facebook on the Hale Hawaii page. So if you are interested in participating in the Padlet, that is one of the main purposes of this town hall, is to give people a safe place to report things that they know about, whether you're hearing it from your kids or from your administrators, from your teachers, or if you are inside the schools and you don't know where to talk about these things. That's our purpose, to give you a safe place to discuss. So I'm going to stop sharing this slide and go to the Padlet itself to see what's popping up.
Awesome. Thank you.
It might also be helpful to tell us when you say a letter, is it a physical letter that's carried home by the children? Is it mailed out, US mail, or is it an email? Because we know many of our families do not have access to email or do not regularly check their emails. So when you do mention mail, I think that would be very helpful information for all of us. Looks like we have some schools that call home, some voicemail, some robocalls. One thing you might want to comment on is the delay, because often these notifications mention the date at which the infected person was on campus. So I think there's a way of modifying with the 3 dots, if you'd like to modify your answer and put a little more detail. Now it's getting pretty full. So I'm going to scroll a little bit later. Panelists, if you can let me know when it would be good time to scroll up. Can I get a thumbs up for scrolling up? Okay, looks like Dr. Meyer is going to have something to say immediately. Thank you for putting I don't know. I think that's just as important and valid as everything else. Okay, Kara, maybe take it away.
Yep, we are getting a ton of responses on our chat and on Facebook and questions. So we will address some of this, and I will invite Dr. Meyer to share first what your thoughts are or your feedback on this.
When I review this, I'm seeing a preponderance of don't know or no organized system of notification. And I suggest the way parents are going to discover is asking their individual student who was absent from school that day. And that's how you're going to find out who was infected. And I think it's important that if there's a student who's absent, the siblings be looked into as well as a contact tracing component.
I agree. I can tell you from personal experience at our school last year, it was taking 2 to 3 days for a letter to come out via email. You had to open the email, click on a link, and then click on a second link to actually open a PDF, which requires a large amount of technical understanding to get to that point to find out there was a case. And when I asked why it was taking so long, it's because it takes a while for all of those systems to get activated for test results in the school to be notified, I guess. So does anyone else want to comment on this before we start addressing specific questions? You can raise your hand. Yes, Dr. Cohen.
Okay, I just want to comment on how UH is doing this. One of the reasons why there has been a delay, at least at the college campus, is asymptomatic. People don't know that they're contagious. They get tested a week or so after they've been on campus, so there's a delay in testing, and then we get notified. I always get notified, but who's responsible is the chancellor. And we wrote that up in our pandemic response of everybody's responsibility, who was in charge of what. So since I ran the campus health center, I did the testing. And once we got vaccines, also was responsible for administering the vaccine on campus. But in addressing the testing, sometimes the delay is inevitable, and that has nothing to do with the systems that are in place or even the people. It's just the nature of this disease, and it's very, very frustrating, especially when we look at with kids. We may be seeing a whole lot of asymptomatic disease, and as Dr. Meyer mentioned, it may not do anything to kids except for when it does. And then that becomes the big concern. Or when they spread it to somebody vulnerable at home. So those are very real issues that have no easy answers, is I guess what I'm saying.
Yeah, thank you very much. And then I see Dr. Peng, you have your hand up if you want to comment.
Yeah, this is a classical mess here. It was easy when the numbers were small, and we can customize each kind of boxing in COVID. Yeah, test, contact, trace, isolate, and quarantine. Now you have huge numbers. So you got to kind of divide what that question means. You mean a positive test? It's easy to call the parent of a kid with a positive test and say, your kid's positive. Take him home. And by the way, take home his brothers or whatever it is. That's easy. But what about all the contacts? We're not supposed to say, it's Johnny here. And then everybody says, oh, I contacted Johnny. It's supposed to be talking to Johnny's mother or talking to Johnny through his mother. And 45% of the time they don't answer. And when they do answer, 12% of the time say, leave us alone. You messed up enough already. Fine. So you get unresponsive people to do the contact tracing. But the other families said, well, if Johnny's mom not going to pick up the phone, although we don't know who Johnny is, why don't you just tell us it's Johnny so I can ask my kid if you contacted Johnny? That's illegal, okay, to divulge Johnny. Even through the teacher, if the teacher says, it's kind of like Jay. You see what I'm saying? Everybody wants to know who it is, but yet you cannot put it out there, and we cannot do the contact tracing quick enough or wide enough. So if we could, we wouldn't be faced with Delta COVID. Over.
Thank you. Did anyone else have a comment on this before we start hitting the questions? Okay, so one of the questions that maybe you could answer, Dr. Peng, I don't know if anybody knows actually what actually happened with the contact tracing app that was supposed to be automatic. We were supposed to have, a more automatic contact tracing app that worked. And as far as I know, it never got launched by the DOH. The other one was schools are not necessarily notifying or quarantining students and teachers in classroom where there's an exposure. Is that something they should be doing? Should the whole class get notified if a child was positive in that classroom? And should the teacher be notified? So do you have any answers on that?
Yeah, we can notify the agency, like the teachers, but that is to be kept confidential unless there's a need to know. It would be nice if a class had 3 people positive, so we can't figure out who's who. But like Chad said, hey, the guy's not here. I guess he was positive. So you have to struggle. Okay, let's just move on to that other question. Let me preface it here. I was hoping you would ask that question. What happened to that automatic contact tracing app? Because when I watched the rise of COVID in the UK, yeah, from the time they had very little Delta to the time they went to 99% Delta, over about 10 weeks, their case number, whatever baseline, I think was 2,000, it increased 25-fold, 25 times. So that's what I was predicting for Maui. When the Delta first came in, low percentage, 10 cases a day, I claimed that in about 10 weeks, from the time it came in, it's going to be 25-fold or 250 cases a day on Maui. I said this before, and I said it to the mayor, and I think I said it on television. And I guess people didn't quite realize what I was saying. So now we are 3/4 of the way to our 10 weeks on Maui, and we have 8 times the number of cases we had at baseline. Go check the UK data. When they were 3/4 of the way to their 10 weeks, they had 8 times too. I claim we track like the UK. But the beauty of the UK is they peaked and they brought it down after 10 weeks, whereas other countries, Thailand, Japan, Malaysia, a whole bunch, they just keep on going. So Lee brought this up. It was related to me. Let's go look at the UK, what they did. And some people said, well, they shut down. Well, not quite. They did a very focal shutdown. They used their app. And when I went to look what they did, it was called controlling the ping-demic, in quotes, right? P-I-N-G, demic, because they would ping each other on their app. And if you think about it, you can ping. If the guy tests positive and he gives you the permission to ping, you just ping, you have been exposed in the last 2 or 3 days. You can also modify the degree of exposure, X feet, 15 minutes, 15 seconds, whatever you want to do because of Delta. And you just ping all these groups. And there's a warning now. Stay away from people. You might be exposed, but there's a recommendation, vaccinated or not. I think you should get tested in maybe 5 days. It's too early now, but in 5 days, and certainly if you're sick. And once that guy gets tested and he's positive, symptoms or not, then that's pinged. So the pinging occurs exponentially, just like the spread of the disease. I think Lee was alluding to, you got a disease spreading exponentially. You got to do your contact tracing, pinging, whatever, exponentially too, or you'll never catch this. But I like that. It's confidential. The mayor made Maui kind of bought it first. He bought it. It's not expensive. We demoed it about 6 months ago. It was kind of fun. I put up a dummy ping, and all the people who came within me, they were notified, you've been exposed. And then I had to say, no, that was a dummy test. It's called Aloha Safe. I think it's time to pull that off the shelf. I wrote to the mayor's group this morning, let's try that, Aloha Safe, because I don't think you're ever going to catch an exponentially rising Delta variant with, contact tracing one by one, if they even manage to talk to you. Over.
Thank you. Yes, we need to use some kind of digital contact tracing in addition to human contact tracing, because it sounds like we do not have enough human contacts. I know the other thing that happened last time was case investigators weren't being told to alert people to get that positive sent out. So that's the other thing that needs to get fixed if we use that. Telling people to actually use the app to notify people and remind them. Another question, not necessarily related, but parents are sharing a mask exemption form from the DOE, trying to encourage each other to get their child exempt from wearing a mask. Do you have any thoughts? Does the classroom become inherently more unsafe if that happens, if we start seeing large amounts of children not wearing masks? Or any thoughts about that? or just shock and awe? Okay, Dr. Meyer. Oh, hold on, you got muted somehow. Can you unmute? There we go. There we go.
I'm getting more depressed as we move on, not just today, but every day. There needs to be a little nuance here. Wearing a cloth mask is like wearing nothing. Wearing an N95 may provide benefit. So I'm beginning to think a lot of this is false security. And maybe it prevents people from rubbing their noses, but I don't think it's going to be stopping a variant like Delta with a cloth mask with leaks around the side. And I don't know what else to say to that, but I'm still not willing to abandon the rule for mask wearing, but I wish we had a better system of high quality masks. And it would be nice if DOH or DOE would have a program for mask distribution where we have current masks for everybody in the classroom. We've just got I think we've got a pretend program right now of security that's not really being provided.
So if we're going to bring students back on campus, you think that DOE or DOH should be providing high quality masks to the students to wear every day?
I think that's the only way to assure that, because a lot of our students are on nutrition programs, and so they'll not be purchased, and there'll be issues of use just based around that as a first prohibition from wearing them.
Yeah. I can also share my experience as a parent. I do have 2 of my kids in-person school right now, which you guys might all be thinking is a bad idea, but 2 of them are vaccinated out of the 3. And I ordered really good masks, I think, from Amazon that are from Korea. They're like 5-layer KN95, foldable, really well fitting. And then I hid them so the children would not use them before school started. And I could not find them the day before school started because I hid them so well. And I could not find one for 5 stores. I went to 5 stores and could only find loose fitting cloth masks. So I just wanted to speak to that, because parents, even if they have the means to buy good masks, which are not cheap, may not be able to readily find them easily, or may not know which ones are good. And so that's another good reason to have them provided at school if we're going to mandate good masks. But I did eventually find them, and I actually found some at the hardware store just to give people a heads up until I found the ones I actually ordered and like. Dr. Meyer, did you have another comment? I see your hand up.
No, I'm
Oh, okay. Okay, I'll put your hand down.
No more problem making.
Dr. Altenberg, did you have a comment? Oh, sorry. There we go.
Yes, let me just add. So, I mean, with Delta, why mess around with anything but the best mask? Because the best masks are available widely. So even just recently, so on eBay, probably the best way to get a hold of a mask is on eBay. You know, it may take a week to get here, but you can buy good N95 masks made by 3M for $1 or less each. And so I'm fond of this model. I don't know if you can see it. This is the 3M Aura N95 mask, and it's the 9205 plus. So, you know, don't mess around. If it's the health of your kid, if it's the health of your family, get the best, and the best is available, at least right now. As Delta, if it keeps exploding, these may become hard to get. I don't know. Let's hope that they continue to be available. Over.
Someone's asking if you can type that in the chat, the mask that you have, if you want to share.
Will
that.
do.
Yeah. Let me see. One person is asking, similar to my question, I guess, would be, how safe is it to send my 2 high schoolers back to in-person learning if my 11-year-old will be at home until she's fully vaccinated? So I'm in a similar boat. I have a middle schooler, a high schooler, and elementary school. The high school is basically back to school as normal with wearing masks. We worry about them bringing the virus home to my youngest. The rest of us are fully vaccinated, but one of us has a vulnerable condition. We don't hang out with family or friends and limit going out to essential needs. We're trying our best to keep our kids safe in school. And school is the only environment that they are not avoiding. So are they safe to send their kids to school, in your opinion? What do you think, Dr. Peng?
Yeah, let me try to answer two questions the same way. Against normal COVID, this cloth mask, it would shut down 90%. And how much particles did normal COVID put out? Let's say 10, okay? Now it shut down 90%, so I'm only exposed to 1. Let's say 5 is enough to infect me. So I didn't get infected. So against normal COVID, this cloth mask was fine. But we know that Delta is shedding 1,000-fold more. Holy cow. So instead of 10, it's 10,000. Even if the cloth mask can control 90%, 90% of 10,000 is, I don't know, it still lets through 100. That's surely enough to infect me. So now you see that the mask is relatively just as good, but now you need more than 90%. You just need that little ditzel to infect you. Same thing with the vaccine, okay? The vaccines are eroding. The Delta variant is eroding the protection. Now, automatically, people are going to say, well, then you're anti-vax because you're saying it doesn't have much efficacy, so I don't want a vaccination. Call me what you want. I will still profess to give the vaccination because in my calculation, not severe disease, but for mild COVID and probably transmission, the protection dropped from 95% for vaccine to about 80% for Delta. Still good. It's better than nothing, but still now you're beginning to leak. So when she sends those 2 older kids who've been vaccinated and all the other children, they're older, been vaccinated, you have a leaking group. They're coming home with it, okay? If it was me and that kid at home is the immunocompromised one, I wouldn't take any chances. I would either separate the kid, you guys go to school, and for the next 1 month till we figure out what's going on, you don't come to this Ohana or whatever, to Auntie's house where the other kid is. I mean, really, it's that bad. And you add to that the increased severity of Delta once there's an infection. There's just too many cards stacked against us. Breaking through the vaccine, yes, better than nothing, 80%, I'll get the vaccine, but do not deny it breaks through. Then increased severity, then increased transmission, and now what? You sent them to school. Over.
Well, that's terrifying. All right. So
It should be. No, wait. There's no question we did a good job. If this was normal COVID, we would have eradicated. We handled the California variant. We handled the Brazilian variant. We handled the California, and the UK variant was in Maui. You're left with the hard ones. Okay, you're left with the terrifying ones. You're terrified now? You ain't seen nothing yet. Delta is varying as we speak, okay? Quickly, geographically. This will look like the good old days someday. And that's what I said when we had the Brazilian variant. This will look like the good old days. And that was the good old days. So trust me, things can get a lot worse very quickly. Over.
Thank you. Does anyone else have any comment on this before we move on?
I do.
Okay, this is a case investigator who would like to remain anonymous.
All of my cases in the past 2 weeks have been clusters. They've been children bringing the virus into the household, and even if the grandparents are fully vaccinated, somebody's going to the hospital. So I'm getting a lot of kids, a lot of hospitalizations, and a lot of breakthroughs. This is definitely not regular flavored COVID.
Awesome. Somebody asked, I don't think anybody here is going to know the answer to this, but if there's legal liabilities for the DOE and individual staff for not following the guidelines. Another person asked why schools weren't funded to do outdoor classrooms. I think these are above our pay grade here. The difference between, okay, Delta and original COVID, I think we've covered that. Oahu's positivity today is 7.8, Hawaii Island 7.7. What does that mean about active cases? So we're seeing there's 600 plus. Is that the actual number of active cases, or does the positivity rate indicate there's a lot more? Does anybody want to answer that one?
This is Lauren. Yes, there's a lot more. Yeah, it's kind of like cutting out what you think is a cancer. Did you get the margins? And so we took a sample, like 10 around the margins. Did you get the cancer? Oh no, there's still some positives there. Well, you didn't get wide enough. So you didn't cast a wide enough net, and there's still a lot more out there. Okay, so and this is where California says, hey, when it gets out of control, for everyone you know about, I think it was published out of LA County, there were 44 that you didn't know about. All right, let's be a little more conservative here. I'll bet you there's 4 that we don't know about for everyone we know about. So tell me again about contact tracing versus the pinging on the cell phone. Pinging would ping everybody quickly, extensively, and all we have to do is say, take the ping seriously. You know, if you're sick, go get tested. If you're not sick, stay away from people. I think that's kind of our only hope. Over.
Thank you. Someone said last Q4, we had numerous parents at our school who tested positive for COVID, chose not to inform the DOH and still sent their kids to school. What requirements should there be for these kind of situations? So that leads to a question. If someone tests positive, are they required to report it, or does the lab report it? Does anyone know?
Lab reports it
Okay.
to the contact tracers. The contact tracers are doing the best they can. But if we add pinging, it just pings all the contacts so that even though the case doesn't want to do anything because I got to work, I'm going to send my kid to school, all the contacts are pinged that say, whoa, you know, I've been exposed, so I maybe should stay away. The contacts, you remember there might be 4 or 9 per every case. They will try to triangulate and guess who the person was. That's not useful, especially if you say, well, it can't be me, I was vaccinated. Forget that, probably you vaccinated. So let's not waste our time trying to figure out who the case was, although it's fun to do. Over.
Thank you. Dr. Meyer, I see you have your hand up. Oh, you're muted.
This is for Dr. Pang. Is the Department of Health still using fax transmission for notifications from the lab to the contact tracing group?
Wait,
And
did you
not
say
the-
fax? You mean
Fax.
fax machine?
Fax machine.
Oh, no. Our contact tracers are kind of a little more email and line list and all that. We've kind of refined that.
So
Okay.
the lab notifies, how does the lab notify your office?
Oh, by email, and they notify us, you know, the very first thing they give, you know, I get it early in the morning. They just say, we got 75 today. And then they tell us quickly so we can start the contact tracing, you know, and the mayor wants to know too. But it's kind of sad when the ones we know, for everyone we know, there's 3 or 4 out there just floating around. And the contacts would do something if somebody pinged them.
Yeah, and our case investigators on Oahu had something to say. Did you want to chime in?
On Oahu, we are still using faxes to get our lab reports, which is part of the delay for people being notified or contacted or traced in any way. There's another delay, which is 1 to 3 days, which is our first contact callers. So we don't and cannot do contact tracing on Oahu. Over.
Thank you. Good to know that I guess they're being handled different in each county, but Oahu is our biggest county, so that's a little worrisome. Somebody asked, do face shields increase protection, and does adding plexiglass barriers increase protection at all? Oh, did someone want to comment on that? Okay.
Well, all the work that showed that there was a study, but that was COVID. And I think it showed it was synergistic. It's not redundant to the mask. And if you think about it, yeah, synergistic because it protects the mucosa of your eye, you know, and the mask is this part. But that was normal COVID. And like Chad and we repeatedly bring up, at shedding 1,000 times the viral load of normal COVID, even if the face shield works 90%, wow, you've crossed the threshold to be infected. So we are in tough times now.
So someone else put that recently my family members were exposed by a close and long contact. When contacted, they were told they did not need to test because they were vaccinated. They begged to be tested and were refused because they were vaccinated. They have a young child and work with local public. This took place in one of our remote, isolated East Side communities. I'm not sure what island that's on. I see stress. No. Anyone want to talk about that?
No, there was a CDC recommendation when they saw the vaccine eroding the protection. That, let me think now, they've been vaccinated, but they were exposed. So they tell you, can you wait a few days to incubate it to grow up, you know, get enough to get tested, and then go get tested. They stopped short of saying, and why don't you quarantine? Why, yeah, because that's a little bit too ominous. People said, well, I get vaccinated, I still have to test and quarantine. So they allow you to not have to quarantine, but please get tested in 4 or 5 days and get tested right now if you're sick. So I don't know how long that recommendation will stand, because as the Delta dodges the vaccine, they might say, heck, you should be quarantining too, especially if you're sick.
Yeah. And then another person put, if a small group gets positive from one child, should all of those children have to quarantine? So do all the children quarantine if one of the kids was positive?
Yes, that's exposure. Exposed people quarantine.
Awesome.
Now, you remember, if the kid was exposed, we don't quarantine contacts of contacts. We quarantine contacts of cases, right? I mean, you told me the kid was positive, then all the family quarantines. But if the kid was just exposed, then we don't do anything until he turns sick, okay? And in the old days, whoa, the guy's vaccinated, don't worry about it. We're not in the old days. You test that person, not a kid, but test that person in 5 days. And if he's positive, then we all quarantine.
Another person asked if double masking is better than single mask still. Is that still being recommended? Double mask. Nobody knows.
I can't breathe. I mean, I can barely breathe with a single mask. I mean, I don't know. I wouldn't double mask.
I can. I do. Okay, Dr. Meyer, what do you
I'd
think?
rather get 2 vaccines than 2 masks. How's that?
Yeah, I need a booster at this point, I feel like. Okay, Dr. Meyer, what do you say?
I agree. I think it's impractical. You couldn't get somebody school age to stay with double mask all day long.
Yeah. All
We're
right.
stuck. Just you lower the threshold. You know, that's one thing to think about. There may be benefits from decreasing the amount of viral load through these through an N95. Most infectious disease, the load of the infection affects the severity. So don't discount that being an intervention as well.
Then another person, I don't quite understand this question. If someone comes for a vaccine, how does the provider know if the patient is positive or not? What are the effects of the vaccinated while positive? I'm not sure. And then another question is a vaccine they read that was grown in eggs, like the flu. What happens if you can't take it because of an egg allergy? Because they have people in their family who can't get the flu shot because of that. Dr. Meyer, do you want to answer that?
The advantage of the 3 vaccinations in the US, they're not grown on egg media. So there's no situation there. That's the messenger RNA is not a egg embryo product. And that's the other issue there is that's why they're so rapidly available and why we can modify the vaccine so readily. The egg embryo it takes a while to culture the virus on that and then attenuate the culture or purify the culture for extracting antigens to use in the vaccination.
Awesome. Thank you so much for answering that. Murray, we're going to go ahead and move on to the next Padlet so that we can get through this. So if you want to bring up the next Padlet, and we will post it on Facebook on the Hale Hawaii page for anyone who wants to answer. It'll also be in the chat down here.
All right, we pretty much covered this topic, so I'm actually going to ask the participants on Facebook and Zoom if we can just do the Padlet for collection of information that you would like to share, and then maybe just move on to the next Padlet immediately, since most of our experts did cover this.
Sure.
So seeing that testing, contact tracing, quarantine, and isolation are important parts of mitigating spread, do you know who will be contact tracing the close contacts of positive cases at your school? So it's basically just to find out from families, teachers, educators, bus drivers, all the other workers, custodians, whoever's here, to find out if you actually know who's doing this at your school, since we know that DOH is kind of like asking people on the news to do it themselves. So that's the Padlet, and we're going to put those links in the different chats, and I'm going to share the page so we can look in the responses. So I see quite a few unknowns. Don't know. School admin, DOH governor, and HO. I thought, I'm like, the governor's doing contact tracing now? That's quite interesting. Okay, now when we say drop the ball, that is an opinion. We're trying to ask people not to put opinions. Please put just information and reporting only. If you don't mind, rule number 1, no opinions, just reporting, please.
So someone said they think it might be the keiki nurse, the school keiki nurse. One teacher on Oahu. Someone said it's up to the discretion of the principal, and teachers would not be within 6 feet of students, therefore would not be contacted.
So we really appreciate this information, and it's good for everybody just to kind of see what's going on. That's the purpose here, trying to make it safe. And we are pushing for a hotline. Who knows if that'll ever happen, but this is our best attempt to get some information out early on.
And it's the Safe Return to Schools group on Facebook that's putting together the hotline, or is it High COVID, do you know? Or both?
Basically, it's just an idea at this point.
Okay.
So there's a lot of projects that the very little handful of activists are doing, such as you and I.
Yep.
And me. And yeah, so a lot of late nights, but we care. All right, shall we go to the next Padlet unless there's absolutely a totally pressing thing you must react to, experts?
I think we can go on to the next one because we covered a lot of this. But
right.
it looks like a lot of people don't know.
Well, thank you for everyone. I'm going to stop sharing and we're going to move on to our next one. So, little thing here, sharing screens, eh?
And we will be posting these on the Holly Hawaii page if you want to answer them, and also in the chat here.
So question number 4, what is your school's protocol for staff and students returning to school after travel or when out sick? And I would like to even add to that, or when they're coming back from a quarantine or isolation. So Padlet links, please. What is the protocol for coming back to school?
Oh, Denise had a comment. Do you want, Dr. Cohen, do you want to make a comment? Oh, sorry.
No, I realize that we're answering this question, so.
Maria will share the screen once people start putting answers on the Padlet from the teachers and parents.
All right, we're getting a few comments in. Have not been informed of any travel policies. I know that last school year as a teacher, many teachers were coming back from travel and were worried because the quarantine requirements were changing left and right. And they were worried that, they'd already booked their flight, they couldn't get another flight, they couldn't change it, it was too expensive. And they were like, what am I supposed to do? Just not work the first few days? I need to set up my classroom. So that was a huge issue last year. But as far as my understanding, I personally had not heard anything on this myself as a teacher.
So someone put that students have to have a red return pass. I'm not sure what that is.
Very interesting. That'd be interesting to know if it was a private or public school. Be curious.
Oh, students are supposed to follow safe travels by no students who returned to campus before 10 days and did not test. There's no way to the school to know unless the family self-reports travel. Oh.
Another thing I noticed is there is a screening document online that is linked in the Health and Safety Handbook of DOE. It has all the symptoms to look for. It so that you need to stay home for those symptoms, and yet it, and then it has, things of, coming back, but it never said anything when it comes to screening before you come to school to claim whether or not you've been traveling or not. And I myself, everywhere I go, my doctor's office included, have you been traveling? So I'm just curious why DOE dropped that one personally.
Oh, okay, so the red return pass says, I don't know how they get one, and I'm a teacher at public high school.
Oh, thank you for clarifying that. I appreciate.
Then someone says they'd like to know they have a student scheduled to return from quarantine on the 14th.
Wow, so very timely. All right, should we hear from our experts what they think the clearance should be?
Yep, sounds good. So Dr. Cohen, did you want to comment on this?
I do, and Dr. Peng, feel free to jump in. Currently, right now, we're if somebody tests positive or if they've been exposed, we do the quarantine. We do not require testing to return, even if they tested positive initially, because they could test positive for months afterwards, but it wouldn't be a viable virus. And so I believe after 10 days, now I don't know if Delta has changed that. I haven't read anything where it has. It's still within 10 days that they need to be, and 24 hours without taking a fever reducing medication, such as Tylenol or ibuprofen. Those are the two things. Currently with travel, we just changed this and we're used to changing on a dime. But if you've been vaccinated, fully vaccinated, and 2 weeks later, you don't need to quarantine. If you have not been vaccinated, you do have to quarantine 10 days before coming back. But we don't require testing at this point if you're asymptomatic.
Thank you for sharing that for the University of Hawaii. I did see someone said Iolani School requires anyone who traveled to quarantine for 14 days regardless. Dr. Peng, did you want to address this?
Yeah, it's going to be messy. And a lot of these things were set up for normal COVID. Even normal COVID was having holes. But now you have Delta, okay? Given that vaccine doesn't protect well against Delta, when you're exposed or travel is considered like kind of exposed, yeah? They do ask you to be tested in 5 days. And you remember what Denise said, if it wasn't Delta, why test if the guy is so far out of his illness or his exposure? Because they can shed, but it's not infectious. Turns out that following a vaccine, when they're positive, they're quite infectious, okay? They have very high counts as if they never had been vaccinated. And the CDC just put out a report and they're infectious. So we're kind of losing it on the vaccine. Now, just plain Delta, no vaccine. You go out there to Las Vegas, the mainland is 97% Delta. You come back and you said, okay, never mind, I didn't get a vaccine, I understand that. You still undergo safe travels or get a vaccine. I don't know, that something's got to change, because that was assuming the vaccine works against old COVID. So somebody should kind of say, oh, by the way, just get a vaccine to avoid safe travel. I'm not sure that works too well, okay? I think the protection is down to 80%. It used to be 95%. Well, how about just safe travels then? Well, in our hands, you know, you could pick off about a third of the infected people because they were incubating as they came in. And you didn't pick them up with that safe travel test before they traveled. So that's why the mayor added on the post-arrival test in addition to safe travel. And that kind of helped a bit. Not 100%, but it did help a bit. So now you're putting a pre-travel test, a post-travel test. Can't we just do the vaccine? Well, we used to, but the Delta seems to be dodging the vaccine. Over.
Thank you. And did anybody else want to comment on that? Dr. Altenberg, I see you raised your hand.
Yeah, so it turns out that studies of how much the pre-test from safe travels is reducing the infection of the residents is even less than it's been reported. It may be only 20% for returning residents versus completely untested, unquarantined. So the safe travels pre-test is not doing much at all. And actually, I just want to, you know, this is a deep dive into the weeds in terms of talking about all these individual, measures to stop transmission. But it's like, you know, think of it like on poor California where they have this fire. All right. So you're far away from the fire and there's a few embers landing on your roof. And so you go out and put out each ember. All right. But now the fire is close and now there's embers landing all over your roof and you can't go and put out each and every single one. So what do? You spray down your roof so that each little ember doesn't start a fire. So what's the equivalent in terms of the pandemic? Well, the embers are just people being in contact with each other. It's as simple as that. If people were not in contact with each other, there would be nobody to transmit to. And so, right now we have an exponential growth rate of about 7% a day. Okay, in the time it takes people to get vaccinated and become immune, we would have something like 13 times as many cases as today. So if you're talking about what's 13 times 600, it's a horrible number. You don't even want to look at that. And so we have to do more. So, I mean, all this talk about vaccination now, it's 5 weeks too late. It's not going to help. It's not going to stop the current wave of Delta. It's gonna protect people if they can hold out that far and not get infected in 5 weeks. But the only thing that's going to change the exponential growth rate is if people change their behavior. So in the past, we've had really high growth rates, and the only thing that's brought them down. So in last summer, when we had, so that at the very start of the pandemic, it was exponentially growing, and then the governor issued his stay-at-home order, and it came way down immediately. And then last summer, just at this time, hitting into late August, the numbers were getting to their highest yet, and the governor issued a second stay-at-home order, and boom, that reduced the exponential growth rate by half, and it was the reproduction rate by half. And so what we need now is, the only thing that's going to change it is if people change their behavior. And in January, we saw the numbers coming down as well from the December. And so there was no stay-at-home order then, but people were coming out of their holidays. They were no longer doing their holiday gatherings. And that was enough of a change of behavior to bring the reproduction number down to about 0.9. And so the numbers kept falling in January. So we don't need a stay-at-home order to bring the exponential growth rate down. We just need, on a mass basis, to change our behavior. And it's as simple as just not connecting with people. So now it's useful to have a governor declare a stay-at-home order, but you didn't have guards standing at everybody's house telling them to obey the stay-at-home order. They just did it. All right. And so the same thing can happen now without a stay-at-home order if people just do it. Mel Raposa had the idea of a personal lockdown. Okay. If people decide on a mass basis to not be exposing each other, to not be connecting to each other, we can stop this based on our previous experience. In the previous stay-at-home orders, we brought the reproduction numbers down by 70%, by 50%. And we can do that again if we just all do it on a mass basis. So that would be my plea, is just everybody act as though we were in a stay-at-home order to the extent that you can without hurting your livelihood. But basically throw out all plans to connect with people that you can possibly throw out, because that's what's going to stop it. All right, vaccines are not going to stop this Delta wave because they're a 5-week delay, and it's going to be enormous in that time. The only thing that's going to stop it is people just stop connecting with each other for now.
Yeah, I would like to point out
my plea. We can do it, but we have to do it all together and not wait for some government edict.
Yeah, I would like to point out that even if the pre-arrival test is only 20% effective, it does decrease people from wanting to travel here. They will choose to go to Florida or somewhere else because it's so inconvenient on a very practical stand. Dr. Meyer has his hand up, so I'm going to have you come up.
Just a thought, the Delta wave that we're calling now in the UK and in the United States followed periods of everybody thinking that July 4th had arrived and we could go back to normal. We could go out and party. We could get together in mass numbers. We could dance. We could get drunk. We could have everything like the good old days. And that's contributed enormously to what we're seeing now. And we're attributing it all to it being the mutant strain. I think a lot of this is the behavior we had in late June and early July. It was insane what we did. It wasn't backed by science. It was backed mostly by hope and just being tired of living the new era of COVID. And we're going to probably have to get back to restricting those activities again. You know, I think Lee is right, but this is going to keep recurring. We're going to have wave after wave with this type of phenomena if we have the behaviors that we saw through July and early August.
Yeah. I'm going to let Dr. Peng speak here in a second, but we have so many questions and comments coming in. People are asking about boosters, why we don't have tents funded for outdoor classrooms. Everywhere's booked solid for testing. People that can't get testing, they're saying. Someone wanted to confirm if Delta, you can return to work after 10 days after testing positive. They want to just make sure that is the policy of the DOH still. And changing behavior, someone said, then why are we not keeping kids out of school? That's what we need to do. But the governor did say, just on top of that, I want to re-emphasize what's been happening, is the governor said that schools would be the last things to close. So if that's the case, I mean, I don't know if that means the state intends to close travel first or what that means. Are they going to close businesses before they close school, or is he just saying that? I don't know. But Dr. Peng, I'm going to get to you. I just want to acknowledge, because we have a lot of questions flying in. I want to acknowledge them so people know we're reading them. All right, Dr. Peng.
Let me just pick off one of the questions first. It's 10 days after your positive test or the onset of the symptoms. So if you had symptoms 3 days, or fine. I think we should spend a little more time with what Lee says. I concur with him, but I want to add it. You know, you really got to change your behavior, not like before, because the Delta variant is so much more transmissible. So you really got to do more than what you did before. And if people can't do that, I'm going to ask the mayor, set up that Aloha Safe pinging. So maybe if we ping those guys, you know, you've been really exposed. So you really do have to, I'm not going to mess with your personal life. I'm just telling you, you guys who are pinged, whether you're in school or whatever you are, wherever you are, you got to control your contacts. You know, I mean, kind of a scientific kick in the pants. Otherwise, it's like, yeah, we all got to behave more, but not me. Lee will do it, and then I'll go to the beach. No, it's got to be focal. And by God, you know, I don't care what the governor says, well, we are going to close the schools last. If we activate the pinging and it pings into schools, and, you know, you have half the guys gone because they got pinged out or they realize what to do, then so be it. You close that school. And we will find out, why did that school flare up and not the other school? So when we do this focal shutting down, I expect it to cross anything, except maybe, you know, essential workers or something. But the Delta is so transmissible, you've really got to change your behavior. And when it first was reported from India, they didn't know how high the reproduction number was. Some cities said fourfold, yeah. Some said 1.2. And I guess, so we didn't alarm people. The CDC decided 1.2. It really was 4, wasn't it? Especially with those political rallies. Over.
All right, thank you. If anybody else has a comment, you can raise your hand. Otherwise, I will go on to our next set of questions. It says, based on our current numbers, including children, do those panelists feel there's another school closure that's warranted? If not, what do they believe it would take for a possible closure? So what would warrant closing schools? So can we just get a survey who thinks schools should be closed right now of the panelists? Could just do a raise of hands. That's one. So it looks like one of three or one of four of you guys. So if you don't think, oh, and Dr. Myers raising his hand. Okay. So we have two of four.
That's a hand lower for me.
Oh, hand lower.
Oh.
Okay. So thank you for clarifying. So if you don't think that school closure is warranted, what do you think would warrant it? So do you want to answer that, Dr. Meyer? Does anything warrant closing the schools at this point?
You know, that's the guidelines I've seen and the studies show that most of the infections in students are acquired outside the school environment. We got to think about that. It's what our children are doing outside the school after school hours. We can control the school environment more. And so if we're faced with another year of maybe, another year of hybrid or total, not on-site learning, that's uncontrolled. There's probably as much or more exposure in that environment as it is a controlled environment in the classroom. And at the cost of all the other benefits of schooling. So I think we're going to learn there's going to be infection. It's probably going to be very mild. Our teachers need to be vaccinated. We should have 100% of teacher vaccination if we can. We should have custodial care, bus drivers, cafeteria. We should modify the school environment to make it lower risk than it would be otherwise. In Hawaii, we have advantages. We don't have winter times. We can have outdoor learning. I've always advocated outdoor learning in Hawaii because I think that's the environment our children like and thrive in. And so modify towards safe schooling, get the higher age students to be immunized. I think there's some degree of uncertainty what to do with the K through through the five and 6 year age group. And that's going to be controversial about whether we should immunize that age group or not. And I wouldn't begin to make a judgment call on that. But we can modify the course of the infection for our children. And you got to think, what are the alternatives? This is what stops this pandemic. Everybody's got to be infected or everybody has to be immunized. You have to have resistance and immunization. You have to achieve it somehow. And you have a choice. You're going to run the risk of a severe infection if you choose not to be vaccinated. And that needs to be weighed against the risk of a vaccine reaction. Most people, when they look at that as a choice, think there's less risk from vaccination than from going unvaccinated. And this is not going away. It's not seasonal flu. This is like HIV. It's come to stay. And we have to have that mindset. We're not there yet. It's one bad message after another that's getting leaked out to us as we move along through this. But I think at 18 months, it's like, this isn't a temporary phenomenon. We're going to have to live with this. So let's get vaccinated, play it safe, hope that your immunity is lasting. If not, we'll have, for sure, people have to have additional boosters in the future or go an unvaccinated route, but at your risk. And I think the vaccine push now with the guidelines that we're seeing in the last 2 weeks about vaccination or be tested on a weekly basis are going to nudge the people who are worried about the vaccine, wanting more time, to go ahead and commit to vaccination. And I'll end there.
Awesome. Thank you so much. Did any other panelists want to jump in on schools? Did Dr. Cohen?
Yes, but what I wanted to jump in on, and this is what we did at the college, and I was just like really insistent on it. For the classes that had to be face-to-face, we tried to do everything online, and at a college level, that's more feasible certainly than K through 12. But keep the damn doors and windows open. Air conditioning is not our friend. It is a friend of COVID. And we gotta ventilate, ventilate, ventilate. I just can't emphasize that, along with the mask wearing. And as Dr. Meyer said, get the vaccine, even though it's not foolproof, it's better than nothing. So that was the only thing I wanted to add.
Thank you. And then Dana Moore is here from High COVID. Did you, I see you have your hand raised.
I did. Thanks, Kara. I just wanted to throw in a comment about the school safety, and that my concern is that we are in record high, triple digit cases right now. So I want to ask everyone to just be mindful that we're not in our old COVID type of situation. We've got, as Dr. Pang says, we're living in a Delta world, and we are actually our CDC guidelines are for old COVID. So the 3 feet distancing is not enough. And, we need to have better and safer than what the CDC offers. And that might come down to us making a personal choice too. Just like Dr. Altenberg said, sometimes the mandate isn't going to come down to shut them, to put us on lockdown or to close a school. But what we're seeing is that there are a lot of cases in schools. And I just want to make parents and teachers mindful that there was in-school transmission last year, and we here in Hawaii, and we don't test in schools, and we don't have strong contact tracing in schools. So it's hard for the public, I think, to know that, there's an assumption that the schools will not be the drivers of spread in the community, but I don't think we have enough data to know that. Thanks.
Okay. And then Dr. Pang, I see you have your hand up.
Yes, I would like to give an opinion from Dr. Miskovich. We did talk about this last week. He said, can the schools hold off for 3 or 4 weeks? Because we're right at the crux. I mean, you're at a flexible point, right? So he said it's a win-win situation all around, especially for the politicians. If it gets worse in 3 weeks, in hindsight, whoa, good thing we didn't open the schools. If it gets better, we open the schools. So you lost 3 weeks. It's almost like this kind of delay is not kicking the can down the road forever, but give us 3 weeks. It's actually a win-win situation. We are in a Delta world. What we thought we saw before with normal COVID, we've eradicated normal COVID, and still we have this. Okay, so it can be very spooky. The second reason, kind of a lower reason, you saw from all the Padlet comments, we don't have our act together. I don't know where the testing is coming, who's responsible, is this interim testing, who's doing contact tracing, what is the message? And finally, I would like 3 weeks to kick in Aloha Safe, because we don't ping the kid. Well, the older kids we do, but the kid's parent, okay? And let's see what we can do with that, because I think that helped the UK a lot when they were pinged and told, we're serious about the pinging, behave extra. Over.
Thank you. All right, we're going to go on to our last Padlet question, because we do need to wrap this up, and we've been on for almost 2 hours now. So if Murray, are you still here? Can you?
Yes, I'm here. So
you want to do one last Padlet?
I think what we are doing is we've actually shared the Padlet links. I think people are getting the hang of it now. And some people are starting to leave the call. So we assume that, people are starting to get a little weary. Of course, the information is a little dismal as well. So I can totally understand. So I feel that we should just ask people if they wouldn't mind, just go ahead and share things on the Padlet. You have access to them, and we will address those in future meetings. We have some Wednesdays coming up, 6:30 p.m. for the next 3 Wednesdays in August. And we will try to arrange some events that will cover some of these subtopics that we have had questions about. So please check out those Padlets. If you need to copy and paste them elsewhere when the call is over and do it later, that would be great. We'll be looking at them as we plan for our next Wednesday meeting. And it will be on a different venue, highcovid.org, Wednesday at 6:30 p.m. I think we should wrap up with maybe our announcements. And I just want to thank everyone, especially our panelists. You've dedicated so much time and energy. Little do you know, participants, these experts have not just been giving their time so graciously now, but they have been doing planning with us, and they have been, consulting with us to get these events organized. And we do have a Google form as well for further questions, or if your questions did not get answered, we ask that you repeat those questions in the Google form. So I'm going to hand it back to Kara to wrap things up, and thank you so much. Mahalo.
Awesome. Okay. So we'll go ahead and wrap these up. We will post the Google form in the chat if someone could do that. And I would like to see if our panelists have any closing remarks. We have a lot of comments coming in on the chat still, but does anyone want to have any closing remarks before we wrap it up? Okay. All right. So let me share screen and we will go to our, wrong one. Let's stop and go to our announcements. As Marae said, we are going to be meeting on highcovid.org. It's Teachers Month. So we're actually going to be meeting every Wednesday at 6:30 to discuss what's going on as a group. And so that is, it is not broadcast. I want to make sure people know that is not recorded. It's only in that group. And we do ask that you not screenshot or take anything from that group on Wednesday. So that's at highcovid.org. You guys can submit any questions or concerns here. We will be collecting them. As Marae said, we are working on trying to get a hotline or encourage the DOE or the state DOH, somebody to come up with a hotline to report issues at schools and concerns at schools specifically. I would like to bring up a solution because we talked about a lot of problems. We do have someone from the Pacific Alliance Against COVID here. You can visit them at pac.org, or sorry, pac.info. It's PAAC. So we have Kaolina Kaimana Yasuka. I'm sorry, I'm butchering your last name. If you could go ahead and share your video and unmute and do a quick 5-minute announcement. PAC has been working with schools directly to make them safer.
Aloha, my name is Kaolina Kaimana Yasoka, and I am part of this PAC team, Pacific Alliance Against COVID-19. We are actually a whole group of people. This doesn't even show everyone that is on our team, but it features the leadership team. One of the ways that we are trying to solve this is through a grassroots effort of going to different schools. And last year we piloted at Kamaile Academy, this testing program. And so right now they are still using that model, but they're expanding it. So here are some of the community health centers that they are working together with in their project expansion. Okay, and the reason why is because we really believe that we need to continue to kuho o malu, which means to stand together in protection of each other. And I'm going to show you why. So when we look at, this is from the Hawaii Health COVID metrics, but it shows that a lot of people are saying that the Delta variant is like really highly impacting the unvaccinated communities. And if we look at our communities across our state, the ones that are the most vulnerable are these ones that are light colored here. And if you can see, there are many places across our Pai'aina that are still have a low vaccination rate. And our team really believes in, we don't need to, like, a lot of times the focus is on vaccinating people, but we also need to consider that we need to protect our unvaccinated communities. So if we look at these different areas, it also reflects, this is on Hawaii News Now, July 31st. We see where some of the high cases are, and it sort of reflects these low vaccinated areas, and that is really concerning to us. And one of the reasons why we are also concerned is if you look at this data sheet that's also from that same website, none of our 11-year-old and unders are vaccinated, and only 47.5% of our 12 to 17-year-old students are vaccinated. So that leaves less than 50% that are vaccinated, and so they're all vulnerable. And listening to all these doctors speak about, you know, the effectiveness of masking and how that's really important, and then thinking about, you know, the way the ventilation is in our schools, that's what one of our concerns are. We also are really looking at the Native Hawaiian community. So, you know, this is, there's a lot of disparity in who is being impacted. Originally in October, so I took this screenshot in October, and this was the how Native Hawaiian population was showing their cases. But if you look at it, they were doing a really great job, right? But now we're noticing that they have really actually are meeting the rate of their population. And so this is really concerning to us because we really want to protect those communities. Dr. Alika Mauna Kea, which is one of our members of our leadership team, he grew up in Nanakuli. He, you know, really sees the Hawaiian community as a resource, past, present, and future. And so this is one of the reasons why they're working so hard with all these communities to lower the hospitalization, lower the death rates as well. And one of the core parts is our multi-layered approach. So when we look at a multi-layered approach, you need to look at all these important parts and aspects to them. Okay, one of our issues that we have with the updated DOH guidelines is that they have removed a lot of the layers that are important. They didn't call them core essential strategies, and now they're optional strategies. So physical distancing is really like, is that if it's possible, then we're going to do it. If it's not possible, then they're okay with that. But we actually see that as a really important strategy, as well as testing and all the things that the doctors have talked about today. A lot of these really important layers, all of these parts right here, have been removed from as core essential strategies. So we need to really think about that. When they're saying that they're using a layered approach, it's not a complete layered approach. And so that's something that we're really concerned about. And so I really love how the doctors are asking everyone to really work together to protect each other. We have these 4 modules here. Sorry. One is the module, History of Infectious Diseases. The next module is Ohana Bubble, How to Keep Your Family Safe. Another one is Protection and Prevention. And the final one is module is Testing, Vaccination, and Variants. And so we hope that you will all explore. Anyone can explore the modules if they're open access. I will drop that into the chat after we're sharing. But we would like to invite all teachers. So I really want to make this clear. We have funding for our project until September. I believe it's September 20th, around there. And so anyone that's interested in getting certified, we have a Mahalo stipend. So each module that you get certified on, there's a $50 Mahalo stipend because you're going to be viewing these modules in your own time. And so you have up to $200 that you can receive, but it needs to be done soon because our project is ending for that part of the project. So mahalo to everyone for being here with us today. Mahalo to all the doctors for all of your mana'o that you're sharing.
Thank you so much. Yeah, so PAC is amazing. When we learned about them, we want to promote PAC because they are paying teachers to first learn about this themselves, and then the teachers can take this information and teach it to their kids. And maybe some of these kids who are in homes where they don't really understand COVID or the risk of COVID or the importance of vaccination, these kids may go home and teach their parents. So that's what really inspires me with PAC, and then we appreciate you. So I would like to invite up Burke Burnett. He's the admin for the Safer Return to Schools Facebook group, or one of the many admins. And he is going to share with us about positive cases on campus, a reporting project they're doing.
Hi, thanks, Kara. So this is not quite ready for prime time, but basically there's some reason to think that DOE is not announcing all the positive cases on campus that are actually being reported by school admins to parents. So we are setting up a system so that parents and teachers who receive these messages from their principals or administrators can send them in and have them be documented in a parallel way that's anonymous. We won't record who sends us this information, but this way we will be able to ground truth the case reports coming in from each campus, so that we're sure we have a better picture from the 40,000 foot level of what's happening in our school systems and how many real cases there are on campus. So we're setting the system up, and it's a bit of a complicated system for, we already had 103 or something cases reported this week. I have a feeling, unfortunately, that number is going to increase rapidly. That's only in 103 cases in 3 days, essentially. So it's going to be a bit of a significant task, and a non-trivial task, to go and capture all this information and be able to digest it and present it in a way that we can all use. So I just wanted to give everyone a heads up that we're working on this project, and we hope that we will have a system to announce soon in the next few days.
Awesome, thank you. And if you want to share the Safer Return to Schools Facebook group in the chat, and then we'll also share it on Facebook if anybody, we're also sharing this video there. So the other announcements, let me bring up my slides, but we will hopefully get through them if I can get this to work. There we go. PAC also has a survey. If anybody wants to take that, you can go to pac.info. Also, HSTA members, read the Member Matters email released yesterday and answer the one survey question about COVID safety, please. So if you're a Hawaii State Teachers Association member. And then Wednesdays, as we talked about on highcovid.org, we're going to have teachers, parents, and community members to share their concerns. We also have doctors on there frequently to talk with, so you may get to speak with medical experts as well. And then Dana, do you want to share the catchphrase challenge that we did at the last town hall, the results?
Yeah. Hi, I just want to thank everybody for being here. Thank you to the panelists and to the High COVID ACEs team. Those are our ambassadors of community education who have been doing the long nights behind the scenes to, fight hard for safety and bring good education and awareness to the public. Last week we had, on the 21st, the first town hall, we mentioned that we had a catchphrase challenge, and we had some really great entries, and there were too many to choose just one great winner because there are so many messages out there that you guys have submitted. So what we decided as a team is that we would like to pick one and focus on that. For this week, we will hashtag it. We'll post it on the highcovid.org Facebook page. If we can, we'll also post it on the website. But please check out the Facebook page and like it and follow it so that you'll be up to date with any of our announcements and fun community interactions that we're going to have. So we'll feature the catchphrase. We did have, we'll start you off with the first one, and then I hope that this will be an ongoing project that the community will stay engaged in, because as Dr. Pang and other experts have said, we're in a Delta world. Soon it may be a Lambda world. this is going to go on for a while, and we're going to need to stay vigilant and stay encouraged. So let's start off with this catchphrase: take action for safety and keiki. This is our task. So it's got like a little acronym, TASK. So we'll hashtag that and we'll put it up, and then keep submitting. Those who have already submitted, you will also be featured in the on the Facebook page. And what I would like to challenge the community to do is to please take those catchphrases, create memes, raise the awareness, shout from the rooftops. Let's get this initiative going ground up, and you can be Hawaii COVID Ambassador of Community Education, a high COVID ace, just like us. So, and we'll see you on Wednesdays, and you can join our open forums on Fridays. Thank you.
Awesome. Thank you so much. I would like to thank each of our panelists for being on, and thank all of our team on Hale Hawaii for helping with this effort, and especially thank all the team with highcovid.org and the Safe Return to Schools group. It was a collaborative effort that we've been working on, and it was a lot of work behind the scenes, and we appreciate all of our experts coming on here and sharing their thoughts, opinions, and expertise. So aloha.
Aloha. Mahalo.
Aloha.